Greetings. Let us learn about medical management of gastroesophageal reflux disease, especially about lifestyle changes that are needed to control the symptoms. These are my acknowledgements. Whenever you see a patient with heartburn and you diagnose it as gastroesophageal reflux disease, then you should think about the underlying pathophysiology. So let us review that. Acid reflux causes injury and irritation of the esophagus that is perceived as heartburn. And when you look at gastroesophageal reflux disease, there are several mechanisms that disturb the anti-reflux barrier of the gastroesophageal junction, resulting in acid reflux. Among them, the most important thing is obesity. Obesity increases the abdominal pressure, especially if there is abdominal obesity as well, resulting in increased intra-abdominal pressure and precipitation of acid reflux. So when you see somebody with acid reflux, you should ask yourself, is the patient obese? And if that is the case, we should talk about managing obesity, that is, weight reduction. This can be achieved by talking about specific diet, especially Mediterranean diet, and daily exercise. You also have, as a gastroenterologist, a great opportunity to manage patients with heartburn. When you talk about weight reduction, when you talk about Mediterranean diet, when you talk about exercise to reduce weight and control acid reflux, one should take advantage of this interaction and also educate the patient that what you do to control heartburn is also beneficial to the heart. With weight reduction, there is a 33% relative risk reduction of major adverse cardiovascular events. With inclusion of Mediterranean diet, the risk reduction is 38% for major adverse cardiovascular events. And with daily exercise, 300 minutes per week, the risk reduction of cardiovascular deaths is 26%. So take the opportunity to not only manage heartburn, but educate them about the benefits on the heart. Another important lifestyle change is smoking cessation. Smoking increases the risk of acid reflux by decreasing the lower esophageal sphincter tone and also limiting acid clearance from the esophagus. We know that smoking cessation reduces all-cause mortality by about 29%. The relative risk reduction is 29%. So we have a great opportunity whenever we see a patient with heartburn, if they're obese, and we talk about weight reduction, diet, and exercise, as well as smoking cessation, to not just talk about heartburn, but additional benefits on the heart as well. Another important thing is avoiding spicy foods and limiting alcohol intake. These things do help in controlling the symptoms. Late night meals, typically late into the evening, 7 o'clock, 8 o'clock, after a big meal, and you go to bed early, within a couple of hours after a big meal with fatty meal and a little bit of alcohol with that, that is a recipe for gastroesophageal reflux disease. Avoiding late night dinners will certainly improve the symptoms of gastroesophageal reflux. Typically, one should have at least 4 hours between the last meal and going down to bed. When patients complain of regurgitation of food, you should also explain about the fact that lying flat increases the risk of reflux, and you should encourage them to avoid sleeping flat and instead sleep with the head end of the bed elevated. This measure will improve the esophageal clearance of acid reflux. So we talked about different ways to control reflux, and once there is a reflux, there's going to be some injury and irritation of the neural sensory receptors, and then that is perceived as heartburn. You could also think about, can we do something to improve our ability to control that perception of heartburn? That's where when you feel stressed, anxious, irritated, your brain tends to perceive any minimal amounts of sensory signals as abnormal. So stress management is really another important component to keep in mind. So we talked about different interventions that we could suggest to our patients. Let us review them once more. When it comes to management of gastroesophageal reflux disease, for patients who are obese, weight reduction is important. And I actually tell all my patients to weigh every single day so that they know if they're going in the right direction or not. And I also tell them to weigh themselves using the pound scale rather than kg scale, because even a small increase in weight will be shown in the pounds much more quickly than using the kg scale. Another important thing, in addition to weight reduction, is smoking cessation. Avoiding eating spicy foods and chocolates, avoiding alcohol intake, and avoiding late night dinners. And finally, if somebody complains of regurgitation as a main symptom, sleeping with the head end of the bed elevated. And also, good idea to talk about stress management and relaxation techniques. All these interventions are good for heartburn. They're also good for your heart. So keep these things in mind when you see your next patient with heartburn and address these various interventions to help the patient deal with gastroesophageal reflux disease symptoms. I hope this is helpful. Thank you.